Good evening and welcome to The Big Fight, the first of the year 2021. This show is young at 21, the oldest running primetime show, the oldest running debate show on primetime Indian news television. I'm Sanket Upadhyay, and speaking of 21, the year 2021 has started off to a flying start. With the road for the emergency use of vaccines now cleared, India will now undertake a massive inoculation drive, vaccinating its population in a phased manner. What's the best way forward? A lot of planning has actually gone into this already. For a country as huge as this, there are bound to be massive challenges. Have we been able to iron them out for the fastest and the most effective vaccination drive? What India does will be keenly watched and observed the world over. India has the capacity to produce large amounts of vaccines. We also have, to our credit, success in mass vaccinations. So on the big fight tonight, there's really no fight, and if there has to be one, it is against that virus. The big fight against the virus. As we prepared for this year to be one where all of us quite literally will get a shot in the arm. We will be speaking to the best minds in healthcare on the road ahead and challenges, and also on the show, how states are going to implement this. UP Government Minister Siddharth Singh, as well as Congress MP from Punjab, Manish Tiwari, are going to join us just a short time later, just a little while from now. All right, so let's begin. Let me introduce our guest this evening. I've got Dr. Shekhar C. Mande, as we told you, the best of the minds who will get us their perspective on how this has to be achieved. Dr. Mande is the Director General of CSIR and Secretary of DSIR. I have Dr. S.K. Sareen also, Director of ILBS and Chairman, Delhi Government's Panel on COVID-19. Thank you very much, Dr. Sareen. Bhramar Mukherjee, Health Data Scientist, is also with us. We've got Sangeeta Reddy, Joint Managing Director of Apollo Group of Hospitals, and Dr. K. Srinath Reddy, President of the Public Health Foundation. Thank you very much for part one of the first episode of The Big Fight in the year 2021. Hopefully a positive episode. Let's now start with the first round. We call this the first punch, and we ask all of you to make an opening comment for 1 minute each. So Dr. Mande, let's begin with you. Your 1 minute time begins now.
Thank you very much. As you said, that we are receiving the news from TV channels and newspapers about the possibility of emergency approval for the vaccine. And I think that's a very good start for the year. 2020 has been a very testing year for humanity in general. And all of us have been stretched to our abilities in dealing with this particular pandemic. But the hope that this vaccine offers is enormous. There are challenges, and vaccine is not a magic bullet that will get us over that completely. So we will tread with caution. We'll go ahead, we follow the same protocols, what we were doing, wearing masks, maintaining distance and everything. But yet, the vaccine actually offers a big hope for humanity. Thank you very much.
All right. Dr. S.K. Sareen, we'll come to you now. Your 1 minute, sir.
Yes, life and happiness is all about hope. And through your channel and all the listeners, I think 2021 brings us hope. The vaccine is effective. Vaccine is available, vaccine is cheap and likely to get approved and roll out within a week's time. What more do you want? You only have to put out your arm. And of course, that too in a sequence on priorities. And if you get the jab fast, and if we are able to achieve, and if the community participates fast, we should be able to have effective immunization, vaccination within next 3 months. And India would certainly lead because we have the desire, we have the will, and we have the prowess to do it.
Sure. Bhramar Mukherjee.
Happy New Year to the NDTV team and everyone watching. The expert committee's assessment that Covaxin is safe and effective is truly a landmark moment for India. Kudos to the devoted team of researchers, all stakeholders, and trial participants. I feel really celebratory tonight that a vaccine may come to my family in a few weeks. This gives us hope that we'll be finally able to defeat the virus, protect health and economies, where the vulnerable and vaccinated everywhere, as many as possible, as soon as possible. But we have to overcome the structural barriers for healthcare delivery so that the vaccine reaches everyone. Challenges still remain with identifying and reaching the most vulnerable, adherence to taking the follow-up dose, studies of active infection, antibodies, and long-term immunity. But I have faith with science, and I shall remain with the hopeful.
Okay. Ms. Reddy, your opening comments.
So, good evening, and first, a very happy new year to everyone. Indeed, the government and the scientific community, both global and India, are really assuring that it's going to be a happy new year. I think this is a tremendous breakthrough that's happened, and we should thank the government, the scientists, the manufacturers, everybody for this, because we are really on the brink of a very significant moment for India. It's not just, the fact that everybody's going to get vaccinated, and the COVID vaccination in India could be the largest vaccination program in the world. But interestingly, it's potentially one of the largest preventive healthcare programs in the world. And I think this is truly significant. I do want to call out, I agree with everything that's been said earlier. I want to call out one thing, the fact that India is following scientific evidence for efficacy, effectiveness, taking its time, approving each of the vaccines. That's one fantastic thing. The other is that post-Serum Institute, we have 2 or 3 other organizations very quickly to follow. So the potential 100 million doses, which will be available by January, True. And then 300 million by July from Serum Institute or the Oxford vaccine alone, True. Is going to be augmented further by 2 or 3 other companies. So I think there is going to be adequate supply for the country. And my last point, I think, is the effectiveness of this program is about the methodology of how it's rolled out. And I appreciate the government's thorough planning, their dry runs, the IT platform. So this is truly hope for the new year.
Okay, very interesting point that has been made by Ms. Reddy on methodology, and we are going to talk about this in greater detail later. But Dr. K. Srinath Reddy, your opening comments.
Well, the purpose of these vaccines is essentially to protect people who are vulnerable in terms of preventing severe infection and death. And the second is to ensure that people who are rendering essential services remain healthy and they do not become disabled because of the infection, even if they are to be isolated with mild infection, because then the essential services would be compromised. Therefore, these 2 twin purposes would be eminently served by the availability of these vaccines, even as other public health measures would have to be maintained and the transmission chain curtailed. I believe the possibility of 2 vaccines now being approved, which are currently under review today, also enhances our armamentarium in terms of the choice, both in terms of the production volume, the cold chain issues, as well as the potential for an inactivated vaccine.
Okay. Right. Thank you very much, all of you, for your
range increases.
Yeah. Thank you very much for your opening comments. Let me now ask Dr. Mande. Dr. Mande, this very important point that was mentioned by Ms. Reddy was on methodology that has been used. Even before the vaccines came into existence, we already had a plan in place or an effort in place on its distribution, on how logistically things will be carried out. Do you think that this was with the idea, with the intention that more than the vaccine, it is its effective distribution, right? For it to reach the last man or woman or child at whatever stage. That is the most important. What's the use of having a vaccine if you don't have a system in place? So do you think that this head start that we had in building that system, distribution system, may be effective?
Absolutely right. What you are saying is that the ultimate objective is the ability to reach the last mile and reach the people who need the vaccine. And what the fellow panelists have said, all of them are very distinguished people here, that's the correct thing to do. That how do we actually reach the person who needs it? And the entire preparation of the last few months that the government has made for this, after several rounds of deliberations, is precisely towards that. And I think that gives a confidence to all of us that indeed everything is in place and indeed things are right to be able to distribute the vaccine to all the people in the country.
Now, Dr. Sareen, see, obviously there's good news. We're talking about the vaccine. Hopefully more and more people will be covered. We've already battled something called the pandemic fatigue, mask fatigue, social distancing fatigue. It's happening all around us. We've seen the spikes also as a consequence. Do you think that there will be some form of a preparation for the vaccine fatigue? You know, a psychological sense that people will have, oh good, the vaccine is here. And that can also pose as a big challenge.
It's a big challenge, and I think for vaccine there is eagerness, while for masks and others there is a kind of
compulsion.
Behavioral change. We don't want it. But for vaccine, I guess most people want it. They just want to be reassured that there is no hassle. It's a very well thought of. You know, when a vaccine gets an approval in UK or US, it is based on a very high level impact factor journal. Like for the AstraZeneca vaccine was published in Lancet. It was peer reviewed by so many reviewers. And after that only, and it showed that first shot gives you 70%, second shot gives you 90% plus, antibodies. So the first thing is that this vaccine is good. So do not have anything against it. And it was also proven to be good above the age of 65 also. So what I want to convey is, while the vaccine will come, its efficacy will be on one, neutralizing antibody. The number of people will definitely get some of them infected, but hospitalization, their ICUs were almost negligible after vaccine giving. So people will be safe. They may get infected, but they will probably not be sick enough. And thirdly, the transmission of the virus, which is most important. If you get a vaccine, you may get infected, but you won't transmit in a slight amount. So there must be a clarity that vaccine is effective if you take it. And if we are able to reach out to the people fast, if people accept it, I think community participation will be a major part. Government, scientists have done a lot for this. And I'm sure we will have a smooth rollout in next few weeks' time in the country.
Dr. Sareen, this point that you've mentioned is very crucial and critical if people accept it. Now, obviously, on one hand, you're saying that there is eagerness for the vaccine. Do you also look at a situation where people will turn around and also doubt the efficacy and also the speed at which these vaccines have come? A lot of people who will perhaps approach them with a certain degree of skepticism.
For last 3 decades, I have witnessed the field of hepatitis B. Hepatitis B vaccine given to a newborn or an adult is 99% effective. 99%. But would people take it? 30% of the healthcare workers never bother about it. They never take the second dose. So there is a kind of, lay down attitude of people for vaccine. Yes, if you have vaccine, if you are getting it free, you think, why is it getting free? Oh, why did it get so rapid approval? Yes, rapid approval is required. Rapid approval had gone through all scientific processes at every level. The methodology, the science of vaccinology has improved so much. You can make new vaccines now very fast. It's not the good, bad times where you use 10 years. So people must be clear that this has gone through all processes, rigorous, technical assessments. So I think the vaccine is safe, and millions have taken Pfizer, have taken Moderna vaccine, and I'm sure the COVID vaccine will be a very safe vaccine because it has gone through phase 1, phase 2, phase 3 very clearly. And UK, the company where the UK had bought a lot of Pfizer vaccine, but now whole of UK wants to get the COVID vaccine, the AstraZeneca vaccine.
Yeah.
So I think we should be assured of this, that this is a good vaccine. I think we should come out, participate, and join that. Yes, you are safe only when your neighbor, your friend.
I think that's a very important point that Dr. Sareen is making. Dr. Reddy, would you like to come in here? Dr. Srinath Reddy, would you like to weigh in? Do you think that a bigger challenge or equally big challenge other than making sure that these vaccines have good efficacy is also to convince people to take these vaccines?
I think we need
awareness,
clear communication to convey to people why the vaccine is important in order to prevent severe infection. And secondly, also to get us back to normalcy. This is going to be required because the restrictions on travel, mobility, work will continue if the virus continues to show its presence and people are still vulnerable. So I think the sense of urgency that people have in wanting to resume normal life is going to be the main incentive for them to accept the vaccine. But any misconceptions that they may have must also be removed through clear and open communication repeatedly, both through mass media, but also through local influencers in community networks. We need to really clear any anti-vaccine propaganda and ensure that local networks are active in that area.
Correct.
But I believe the main factor that will be actually convincing people that they must accept the vaccination is the need not only to protect themselves, but to get society back to work as soon as possible.
Correct.
Particularly the schools and the other workplaces as well.
Correct. Now, Dr. Mande, I want to come to you because, as the Director General of CSIR, you must be regularly in touch with the planning that the government keeps doing. I want to know from you, is this part of the government planning? Because I'm sure the government would have seen this coming. See, we can talk about the efficacy of the vaccines, we can talk about the systems in place, all medical terminology is all right. But if people are not willing to take it, that's a different challenge altogether. The kind that Dr. Sareen was mentioning just a short while ago. When people are in a sense of doubt.
There are two issues that we should remember. In the current pandemic, there has been a big fear factor in the public, and many people actually are afraid that if they or their family members get COVID, people have seen actually large mortalities in their close circles. So there's some sort of a fear factor, which I think might work in favor of vaccination. Number two, that at the highest level, the public reach out program has been very, very vocal in this particular pandemic. Unlike many other diseases that we have seen, in this particular pandemic, at all levels, there has been a consistent discussion, consistently telling people that please wear masks, consistently telling people please maintain distance from each other. So that has had some kind of an effect, and hopefully that will work positively in favor of vaccination. One can't, of course, guarantee, as what Dr. Sareen said, that it's not guaranteed, but nonetheless, I guess that awareness among the public for taking vaccines is much better this time than other diseases.
Right. Ms. Reddy, I want to come to you, Sangeeta Reddy. I want to understand from you this entire initiative, putting everything on CoWIN. I think when you discuss methodology, the use of technology to put everything on, using technology to put everything on the internet, efficiently managing data, do you think this in itself will be a one-of-a-kind exercise? I mean, we had Mr. K. Vijay Raghavan, Professor K. Vijay Raghavan, who's the principal scientific advisor on our show one of these days. And he said that this exercise, if you really want to compare it in terms of scale, is equal to the general elections, Lok Sabha elections. It's that scale that we are talking about.
So absolutely, it's that scale with an added dimension of the entire medical element and the prioritization of who comes in first. So I think we need to first, quickly understand. So Group A, the 1 crore people are healthcare workers, those who are working in healthcare settings. Group B has been announced by the government and planned by the government are the frontline workers. So personnel from states, central police, armed forces, home guards. Then there's Group C, which is about 27 crore people who are above 50 and those who have associated comorbidities. Now these comorbidities, hypertension, diabetes, cardiovascular problems, cancer, post-transplant. So this is a very vulnerable group because, when they get COVID, the mortality is higher. So planning this first phase itself for about 30 crore people, this is only 3 crore less than the entire population of the United States. So this is a huge exercise. And I think if you look at the fact that one is you need to communicate of who's eligible, where do they live, where should they go to get the vaccine, what is the timing, then the beneficiary needs to acknowledge this. Then you have to look at the second dose in the right time and then monitor the side effects. So only a technology platform could have truly enabled this to happen effectively. And I think India, you take the success of all the other technology platforms which have been put forward, and I think we are able to show the world that this is something we can do. This is a major moment for India. It's hope, it's acknowledgement of the medical community. It's a fantastic showcase of the government's capability to put together large complex programs and execute a rollout in a win-win manner.
And this is one area where India has expertise.
Absolutely. You look at, the multiple things which have been done, and those were the foundation. This technology foundation is going to showcase India in such a good light. So I think it's a time for us to be positive, to acknowledge the scientific process which is being done. I also would like to, say that I am confident that the public are well educated and waiting to take the vaccine because the awareness levels of COVID have been so high and everybody wants to get on with life. So I'm really looking forward to a very positive, smoothly orchestrated, public-private participation led by the government. And I think it's for us to really acknowledge the great role from Prime Minister to health ministries to state governments to even frontline, healthcare workers, everyone, and the responsive public. So let's do it together and show the world.
We here at NDTV have celebrated the selfless service by the saviors, the frontline warriors.
Yes, Sanket, and thank you for that. It meant a lot to everyone in healthcare. Truly.
The basic idea behind that was to appreciate that this is not a duty, it's not just a job that has been done by this fraternity, it's a service. And the more we approach it in that way, in that sense, the better it will be in order to appreciate what they are doing. But Ms. Mukherjee, I want to come to you now, and the natural extension of this argument is that when we carry out an inoculation drive, a vaccination drive, what is the time frame one is looking at? So obviously there is phase 1, then there will be phase 2, phase 3. Ideally, to defeat this virus, what in your wisdom is the time frame that one should look at to complete the vaccination drive? See, because if you compare this to a general election, only 90 crore people vote or are eligible to vote, of which then there are some people who don't. Here you will have to vaccinate 137 crore ultimately.
Yes, so there's a couple of things actually. A lot of things have been mentioned already. I think that vaccine hesitancy is probably less of an issue in India. It seems like the communication infrastructure has been quite strong, and we have to get buy-in from religious and community leaders. I have been very impressed with how India has scaled up testing. I can say on national television that it was much easier for me to get tested in India multiple times than in Michigan. So I think that with that infrastructure, the public-private partnership, India will be able to scale up. And the time, I think that while it is time to be hopeful, I think it's very vital that everyone continues to play their parts to drive down infections, because it will still take a while to inoculate a safe number of people so that we can be confident. And also, it's not just India. I think you have seen that as long as the virus is circulating in the world, our health is interconnected. So we'll have to really be patient, and also additional safety and efficacy data for the vaccine will continue to accumulate from the ongoing clinical trials as well as real world evidence. So I think I'll say that 2021 will be our work towards getting to a very safe world. But in the next 6 months, I see a lot of hope and optimism and a lot of infrastructural work being done. But I think it would be at a multi-level for different ethnic demographics, different rural-urban setting. The approach will be quite different.
Okay. Dr. Mandey, let me now quickly come back to you. Two questions or two sets of questions that I'm going to take across this panel. Number one is a study of which you were a part of. You conducted this study. I can see you are smiling. It was an interesting study, but it is now being seen or talked about as some sort of a hygiene hypothesis. Would you like to tell our viewers what this is about? We can put that on screen also. The study says that rich countries see more COVID-19 deaths due to low immunity. Better hygiene paradoxically causes high death rate in rich countries. Dr. Mande, are we to assume, you then say countries with poor sanitation record low death rate. What does one conclude with a study like this? Surely you don't imply that we should not have hygiene standards.
Absolutely not. I have given a disclaimer in the paper that a study by no means points to moving towards lower hygiene. So we started with a perplexing observation that countries with higher human development index or higher GDP appear to have more death per million of the population. And if you look at today, even countries like Belgium, US, UK, Germany, France, Spain, Italy have more number of people dying than African countries, Southeast Asian countries and all. And the obvious explanation would have been that Southeast Asian countries, African countries, South Asian countries are underreporting. But the underreporting would have to be at a scale which was unimaginable. So obviously it was not true. Also it's true that countries with high GDP or higher human development index, the average age is higher. We know that life expectancy in those countries is much higher than here, and we know that COVID tends to kill elder people more than the younger people. So that was also another explanation. But we also know that COVID actually has two facets of it. In the initial phase of the infection, the virus multiplies in the body with large numbers, but at a later stage of infection, the viral load has gone down, but body's immune system hyperreacts. What is called as a cytokine storm or some sort of an autoimmune reaction. And people are actually dying because of the second phase. That is the cytokine storm or hyperimmune reaction, and that's the main condition of death. Now, in the countries with high HDI, there is a larger percentage of those kind of diseases, autoimmune disorders, or what you can say, that is what we also call as non-communicable diseases. While countries with low HDI or low GDP, there's higher incidence of communicable diseases, but high incidence of communicable diseases, but low incidence of non-communicable diseases. And therefore, we put together all the parameters, about 25-30 parameters, and did what is called as linear regression. And the general conclusion was demography of a nation, that is the average age of people, urbanization, all those things, then more incidence of non-communicable diseases, and obviously that is related to better sanitation parameters, hygiene and all of it gives the best kind of correlation. I have shared the paper with Dr. Srinath Reddy. Maybe he can also offer some sort of peer review on this on the TV right now.
Sure,
thank you.
Sure. I can ask him. Dr. Srinath Reddy, would you like to weigh in on this report? I mean, could this perhaps be the silver lining in India?
Situation, it's not just India. Other South Asian countries, Africa, all of them have had both less cases and, more importantly, far less number of deaths. And all the reasons mentioned by Dr. Mande are very valid. Younger age, certainly, and also a larger rural population where the spread of the virus itself is slower, but also the comorbid conditions like hypertension, diabetes, heart disease, and obesity are much lower. And all of these factors are contributory. It's also possible that repeated exposure to other infections might have built up non-specific immunity. Unless that's very clearly measured, it's difficult to say. But if you look globally, that is the experience that we are seeing, that there is actually an inverse gradient between countries of countries with a higher socioeconomic status and greater urbanization seem to have done worse than countries which are less economically developed and have much lower levels of urbanization and industrialization. Of course, in the Western countries where the social gradient is already reversed and where the poorer sections actually have many more of these non-communicable diseases like hypertension, diabetes, and heart disease, they have actually died in larger numbers. But across countries, this particular gradient mentioned by Dr. Mande holds perfectly good.
Yeah, because this is, I just hope that at the end of this report, people don't start celebrating low hygiene or sanitation standards. Dr. Sareen, do you want to weigh in on this? I mean, it's good that we see it's conventional wisdom, I would say, that because our bodies are subjected or exposed to greater amount of infection, we have greater immunity. Is that the reason by which you can explain lower COVID figures from Bihar and UP? I mean, Bihar saw an election of a kind where you had, the death of social distancing, and yet you have not had massive cases from that state. Could this be the explanation?
I think the quality of an anchor is that he can see both sides of the coin at the same time, which many of us can't see. And I enjoyed the way you picked up the things. But the fact is, science has shown for many, many years that if you are exposed to, the children who get the water bottle from home, they never get hepatitis A. They get hepatitis A in adulthood. But the village children generally have water which is not of high quality. They get infection and they are immunized before they are 10 years for hepatitis A. So hygiene does not mean that you lose other things. Hygiene means that sometimes you get exposed, and Indians, because of the way they live, they're exposed more and they get more exposure to antigens. So more antigens, you get more antibodies. That doesn't mean that you leave hygiene. But as of now, we are exposed and we are fighters, so we get more antibodies.
Yeah.
But never lose that concept, hygiene, and especially in corona times, washing hands and keeping all that sanitization, strictness should never go.
Yeah.
And I want to add here that the vaccine, sometimes like comorbidities, kill more people. But vaccine sometimes is not as effective in those who have comorbidities. There is very limited data. Those who are obese, those who have got hypertension or other kinds of diabetes, is the vaccine and the neutralizing antibodies are as much as not. We have to wait for that. But for general healthy people, the volunteers are general healthy people.
Yeah.
So the data available to us is that. So therefore, all the more reason those who are having comorbidities, even if you get a vaccine, please do not give up the COVID appropriate behavior. Maintain it so that you are protected and your neighbor
So
is
in other words, Dr. Sareen, I'm sure Dr. Mande will also join in saying that even if there is a vaccine, don't stop wearing the mask and don't stop practicing social distancing. Is that what you're saying? Vaccine or no vaccine?
Absolutely right. Completely agree with Dr. Sareen that vaccine is one of the solutions, but doesn't mean that we actually stop COVID appropriate behavior. We must follow that until the case burden comes down significantly. So I think we should follow that very strictly, and Dr. Sareen has put it very succinctly why we should do that.
Okay. My final my final question, which I'm going to ask of everyone, and we'll begin with you, Dr. Sangeeta Reddy. The mutations, right? There is a huge concern among people that there are. See, it's a virus. Virus tends to have different strains. There are mutations. So what is the likelihood of a person getting a jab and then after that a new mutation coming in and making that jab useless?
So as we all know, this is something that we are discovering as we go along. However, with current scientific data, what has been spoken by multiple scientists and all the research in the papers we know, the variant of the coronavirus, which was discovered in the UK, said to be more contagious. It's also appeared in California and other parts of the US. I think Colorado also said it. But the main point is that though this strain seems to be transmitting a lot more rapidly, I think what Dr. Fauci said was that it does not appear to be resistant to the vaccines that have been developed so far, because the vaccine platform itself that was developed was already designed for about 17 different mutations.
Correct.
And the expectation is that it will cover even this mutation. So I don't think we should be concerned about that.
But still, we know
must be
little.
Watchful,
The
but
more
not
we know about this
suspicious.
virus, the lesser. Because, right now we know very little about this virus. So we cannot conclude. Will that be a correct assessment?
I would say for now we should proceed with the assumption that this platform should be adequate while scientists continue to evaluate, research, and keep on going in terms of vaccine improvement.
Dr.
That would be
Sareen
how I would state it.
Yeah, Dr. Sareen and Dr. Mande, would you like to weigh in on this? 15 seconds each, running out of time. Yeah.
See,
Dr. Sareen.
Mutation is an attempt by the virus to survive between the fight of the body N of the virus, it has to change its shape. This is for any virus. This is an RNA virus, it does it very fast. And mutation is the survival of the fittest. Let's say there were 100 particles, 99 your body kills, one survives. Now that virus you transmit to the other guy, he transmit to two. That's why in UK it took 3 months for from the first detection to 80% of population getting the mutant virus.
Correct.
So this is going to happen. Now say there is a first mutant from UK, the second would be faster, third would be faster, and therefore mutants are going to be part of the game. We have to understand and not to be afraid. What is important is that if you vaccinate, there are two strategies. One, you give 2 doses to everybody. One, you can vaccinate very rapidly with 1 dose, and that's what UK has changed their strategy. Give 1 dose to everyone so that everyone has antibody levels. Therefore, we have to vaccinate fast, accept it. Mutants will come to the virus, but current vaccines are effective. Be assured that they will be useful for you. So please take it.
All right. I've completely run out of time, but thank you so much, ladies and gentlemen, for joining us on this extremely engaging discussion. Remember, the name of the show is The Big Fight, but this is a big fight against the virus, and the vaccine is here. Thankfully, 2021 is going to be a good year for all of us. Thank you so much, all of you all. How are states going to implement this this mass vaccination drive? Let's ask the minister himself for the largest state in terms of population and size, Uttar Pradesh. We've got Mr. Siddharth Nath Singh. He's a minister in the Uttar Pradesh government, is now with us. Thank you very much, Mr. Singh, for joining us. My first question, the vaccine is here. How will Uttar Pradesh gear up for it?
Well, I think UP has been gearing up for a very long time. And we have a past experience also where we maintained a cold chain, particularly after 2017 when Yogi Ji's government came, and with the impetus given by Yogi Ji himself on the Japanese encephalitis and measles rubella, where in fact we got as an award for the measles rubella program, that vaccination program that we ran through in Uttar Pradesh. And therefore we have a cold chain system in Uttar Pradesh, which under various protocols, SOPs were built up, and which was highly appreciated by UNICEF and WHO organizations. And based on that experience, we have also carried forward building our COVID vaccination program. And I'm happy to say that yes, UP would be conducting the maximum number of COVID vaccination program in the country, and that would be anything in the first phase itself, where we'll be taking various categories, category 1, category 2 and category 3. It will be almost about 3.5 crore individuals will be vaccinated.
Mr. Singh, a state as huge as Uttar Pradesh, you say that UP has some prior experience with dealing with diseases like the Japanese encephalitis. But you think managing an effort such as this will prove to be a very, very difficult and arduous task? What are the possible challenges that you can think of?
Well, let's roll it back, When when we came in government, there was always a question mark towards the health sector, and people did speak about the Japanese encephalitis and acute encephalitis syndrome. And it was mentioned that, the death rates will never come down of the children, which was affected in 38 eastern part of Uttar Pradesh. But today I'm happy to share that the numbers have just come down into two digits from 4 digits. So these are some great challenges that we faced. And even during the COVID period also, we ran a program, and it was always a challenge for the country that how the UP, Bihar, West Bengal, Assam, all these states are going to behave during the COVID challenge. And UP did turn out to be with an exemplary example. UP also gave in the COVID management, which again the WHO appreciated. So I think we have the will, and we have the leadership to run this program well. And the challenges which are there, they need to be extrapolated to face these challenges. But the standard protocols, if they are in place, they can be always extrapolated to face those challenges. If the numbers have to be counted.
Okay. Now, Mr. Singh, a very important question that I want to ask you. In your wisdom, do you feel that the vaccine should be free or against a charge? What should be the correct way of going about?
Well, I think a few things we should leave it at the central government to decide. And the idea of any government, whether it is UP or any other state, the idea of the state and at the center is that we must reach out to the maximum number of people, and those who cannot afford, they must be given this vaccination as on free of charge. And they will be always available in the market. Those who can afford, they will be going into the market. But I'm no one to decide on it. But at the first stage, I think when we look at the health workers, we look at the frontline workers and those who are 50 plus, we are going to reach out to them with this vaccination program.
Sure. Mr. Singh, how long do you think this vaccination process is going to take place in a, or take, according to you, in a state like Uttar Pradesh? It is a giant state. It's got a huge population. And, you know, the biggest risk that one faces is the possibility of pandemic fatigue. Do you think that while this inoculation drive is going on, that messaging also needs to continue to force people to do something as basic as maybe wear a mask?
Well, the mask and the social distancing has to continue during the vaccination program. There's no two ways about it. But a state like Uttar Pradesh, I do feel that if we begin in January with the dry run, which is going to start very quickly, and then it will continue, it will go up to anything about June, we should be able to complete that cycle.
Okay. My final question, I think you mentioned about UP having cold chain facilities. You said that just a short while ago. You think UP is equipped to handle delicate vaccines? For instance, there is an approval to the Pfizer vaccine, which requires minus 70 degrees centigrade. Do you think UP will be able to handle these needs of these delicate vaccines?
Oh yes, UP is absolutely equipped. During the COVID, we added, the cold chain in 22 districts so far. We have 75 districts. And as I said, the past experience is helping us, and we have this cold chain available, and that has been created. So that will not be an issue. Each district of Uttar Pradesh has a cold chain. We do, as per the vaccination program that has been given to us, we do need to have a capacity of 2.03 lakh liters. We have already built in of 2.50 lakh liters. So the capacity is more than what is required.
All right. Mr. Siddharth Singh, thank you so much for these words. Hopefully things should roll out smoothly in a state like Uttar Pradesh and elsewhere in the country also. We're stopping for a short break here on The Big Fight. When we come back, we speak to an MP, Congress MP from Punjab on what he feels needs to be done. Manish Tiwari is going to speak on what he thinks ideally should be a state-wise plan and what really needs to be done as far as distribution of this vaccine is concerned. Stay with us. All right, joining us right now is Congress MP, Mr. Manish Tiwari. Mr. Tiwari, thank you so much for joining us right here on The Big Fight. My first question to you is, the vaccine is here. New Year begins, thankfully, on a good note. Your thoughts on what needs to be done from here on? See, we have overcome one challenge, but the rollout of the vaccine in itself is going to be a challenge.
Well, Sanket, first of all, a very happy New Year to you and to the entire team at NDTV, and of course all your viewers who are watching this program. May 2021 turn out to be better than 2020, which was a terrible year, and I think that is the understatement of this year. Having said that, if I heard you or Vishnu properly, apparently what was being said is that the vaccine is being approved for emergency use. So therefore, it's not very clear at this point in time. What exactly does the government have in mind? Are we going to have a full and complete rollout of the vaccine, or is the vaccine going to be administered to those people who are most vulnerable? And I think there is an obvious waterfall to that. You know, the elderly, the infirm, people who are above 80, they obviously should get the first priority. Then the frontline health workers in our hospitals, the nurses, the paramedical staff, even the class 4 employees who battled COVID-19 very heroically over the past 9 months. They must be accorded priority. Our armed forces, definitely, given the fact that we are in a face-off situation in Eastern Ladakh, as also our law enforcement instrumentalities, they rank in the pecking order of priority. And so therefore there is an obvious waterfall, which I think is the logical course of action to follow. I believe on the national portal, the government has uploaded, certain criteria of people. I am not really very familiar with the details as to what the pecking order is. But I think common sense and prudence dictates that this is what really should be the rollout plan.
Correct. Now, Mr. Tiwari, the next logical question is going to be, you're right when you say that this is authorization for emergency use and not a full-fledged rollout. But assuming that that is going to happen sooner rather than later, you hail from a state of Punjab, you represent the political party of the Congress. I want to ask you, what exactly is the view of your party and the view of the government of Punjab on, how it should be given and for how much? There is still a lot of ambiguity on whether it should be free of cost or against a charge. What is your view?
Well, I cannot really answer that off the bat, Sanket, because that's a tough question. And I think it will be inappropriate for me, in the absence of any consultation, either with the state government of Punjab or the Indian National Congress, whose national spokesperson I continue to be, to really articulate a position. But my personal position would be that I think it should be dependent upon means. Those who are vulnerable, who are not in a position to afford the vaccine, obviously need to be vaccinated free of cost. But those people who are in a position to pay for the vaccine, and I don't think it's really going to be a very expensive jab, I don't think that there is any harm in charging them a vaccination fee or something. But as I pointed out, this is purely my personal opinion, looking at the whole thing in a very logical and a straightforward manner.
No, the reason why I asked you this question, Mr. Tiwari, because this is obviously the next logical thing to happen. When you inoculate a whole section of people in different states, then who pays for it? See, even if it is free for the people, somebody will have to foot the bill. Let me give you an example. In the run-up to the Bihar elections, in the BJP's manifesto, it clearly said that if they come to power, they are going to make sure that the COVID vaccine is free. Upon being asked this question as to why it should be free in Bihar only and not elsewhere, they said that the state governments will procure these vaccines from the center, and then the state government can decide whether it wants to give free of cost or not. If we come to power in Bihar, we'll give it free of cost. Similarly, other states can also decide.
Well, Sanket, on the first day of 2021, I do not want to use harsh words, but for the lack of a better phraseology, I think that was an extremely obtuse position to take. We should not politicize the vaccine under any circumstances. We should go by the past templates that we have. India has been very successful in rolling out mega vaccination programs over the decades. In fact, one of the reasons which is not yet substantiated but claimed even by very eminent medical experts is that because of the BCG vaccination program, maybe our fatalities to COVID-19 has been less. Then we successfully rolled out the pulse polio vaccination program for every child below a certain age across the country, and which was extremely successful. So therefore, we have a tremendous amount of institutional experience and institutional memory when it comes to rolling out such mega vaccination programs. And I don't think this is something which should be politicized and really left at the whims and fancies of A state government or B state government as to who wants to do it free of cost and who wants to do it for a charge. I think that's a completely and absolutely wrong way of doing it.
So you think the best way will be a centrally monitored, a centrally coordinated effort, a national effort, and not a state-specific effort?
Well, there has to be a uniform criteria. I mean, it should not be that, and I don't want to cast any illusion or any aspersion on any state. It should not be that A state is giving it free of cost and B state is, charging a certain amount of fee. I think there should be a comprehensive criteria evolved. There has to be a triage as to how the rollout has to happen, who's going to pay for it. Will the state government pick up a certain amount of the tab? Will the central government provide a certain amount of subsidy? Will the recipient be paying a certain fee? And those who are more vulnerable or are the vulnerable sections of society, not essentially below the poverty line, they would be inoculated free of cost. I don't think there's any rocket science involved in really laying out this criteria. But to politicize the vaccine, to put it in your election manifestos, to say that if we come to power, we'll give it free of cost, I'm afraid is really reprehensible, because every human life is as important as the next one, whether he or she is an election-going state or in a non-election-going state.
That's a very youthful and interesting shirt that you're wearing, Mr. Tiwari.
Well,
is this an attempt to look young and escape the jab?
This is called trying to recreate your youth when you are getting on in years. Yeah, this is my motorbiking jacket, and this jacket itself is about 25 years old.
Thank you so much, Mr. Tiwari. Thank you so much for joining us.
Lovely, and Happy New Year once again.
Same to you, sir. Thank you so much.
Bye.